For a long time, patients suffering from fistula-related complications from Nyanza and Western regions had no idea where to seek help from whenever they experienced such complications. Some waited for years to attend free medical camps that are organized once a year, either in Nairobi or Eldoret, in order to have their plight addressed. Fistula Foundation has now established a treatment center in Kisumu where patients will receive free medication and even undergo repairs to restore their dignity.
Janet Anyango from Nyabondo in Kisumu County has had to contend with the stigma that comes with fistula complication for the last 12 years. She's among the many women who cannot afford the cost of undertaking corrective surgery for fistula. She and many others in this ward had almost resigned to fate until they heard of a new fistula treatment center at Kisumu County Hospital.
Sasa nikapata hiyo shida na singeweza kujua nitajisaidia aje. Na pia walikuwa wanahitaji pesa mingi. Na pia walikuwa wanasema daktari wa hiyo ugonjwa haipatikani kwa urahisi. Sasa nikakaa tu mpaka siku hivi juzi ndio nikasikia wametangaza.
Hii shida nilipata wakati nilifungua mtoto. Sasa hizi kuna miezi 4. Mtoto nijifungulia kwa hospitali lakini sikutengenezwa. Sasa kutoka hapo nimejaribu kuzunguka hospitali nazunguka mpaka wanafika pale wanatengeneza lakini bado haikui tena inarudi.
They are the first patients awaiting corrective surgery at this hospital. But even as the patients remain hopeful, an acute shortage of fistula surgeons in the country makes it hard for a big number of patients to be treated. According to the outreach manager, the country has 8 trained fistula surgeons, and every year they identify 500 patients in the former Western Nyanza and sections of North Rift, yet only 300 receive treatment.
Every other year we have a backlog of between 150 and 200 clients in Western region of Kenya. We are not able to handle more treatment for the fistula clients because of the technical capacity. So you realize even if you had so many treatment centers without the personnel to be able to do that, you cannot be able to treat them. So the challenge with the doctors and with the treatment facilities and the equipment.
Fistula arise because of poor maternal health care. And there are 3 delays that lead to maternal deaths and sometimes fistula.
The move to establish the treatment center is to enable many patients access treatment at any time without waiting for a whole year for the one-off medical camp.
This is going to be a routine service, which means that women can come every week. So we're doing screenings every Monday, and then women can be admitted that same week for fistula repair surgery. Our target number for the year is 120 women treated here at Kisumu County Hospital, but we hope to exceed that number.
The high level of stigma associated with the disease has forced them to change approach in identifying fistula patients. They now move door to door, besides using religious gatherings to sensitize the community on the clinical signs and symptoms of fistula. The foundation has also embarked on a program to train an additional 6 surgeons over the next 3 years.